January 1945. The bitter wind cuts across a makeshift field hospital on the Philippine island of Leyte. Canvas tents flap against the frozen ground. The air smells faintly of antiseptic and gunpowder, a reminder that the front lines are never far. Inside, rows of metal cots hold soldiers pale from fever, exhaustion, or wounds that medicine struggles to mend. Japanese nurses move silently among them, hands steady but eyes weary, accustomed to scarcity and suffering. Then, something unexpected. American medics place small vases of wildflowers beside the cots. Flickering candles illuminate faces etched with fatigue. A soft hum of music drifts from a battered phonograph in the corner. For the Japanese nurses, trained in pragmatism and discipline, it is a bewildering scene, an oasis of calm and care amid the chaos of war. They pause, hesitant, observing the meticulous arrangements. There is no pomp, no announcement, only human kindness quietly asserting itself. In that moment, the war seems to shift subtly, not through bullets or artillery, but through gestures small yet profound. The nurses, silent witnesses to this unexpected humanity, could scarcely believe what they were seeing. The stage is set, a clash not only of armies, but of cultures, expectations, and the very definition of care in war. By late 1944, the Pacific Theater had become a maelstrom of movement, strategy, and unrelenting combat. The Allies had gained momentum after the hard-fought victories at Guadalcanal, Tarawa, and the Mariana Islands, each battle pushing the Japanese defensive perimeter further west. The Philippines, a crucial strategic hub, stood as the next objective, an archipelago whose capture would sever Japan's access to vital resources and pave the way toward the Japanese homeland. Japanese forces, entrenched yet overstretched, struggled to maintain cohesion. Soldiers and medics alike faced dwindling supplies, malnourishment, and the psychological toll of constant bombardment. Field hospitals were cramped and improvised, often established in commandeered schools, churches, or caves. Electricity was intermittent. Medical instruments were scarce, and infections spread quickly in humid, tropical conditions. Nurses, both military and civilian, worked under relentless pressure, moving from cot to cot, performing triage with remarkable efficiency, yet always on the edge of exhaustion. Meanwhile, American forces approached with meticulous planning. General Douglas MacArthur, returning to the Philippines as promised, orchestrated a series of amphibious assaults that combined naval bombardment, aerial support, and ground operations. The U.S. Army and Navy Medical Corps were an integral part of this strategy, not merely tending to wounded soldiers, but anticipating logistical needs months in advance. Mobile surgical units, sterilization teams, and supply convoys ensured that casualties received prompt treatment. Field hospitals were constructed with care. Tents were elevated to prevent flooding, drainage ditches were dug to minimize disease, and temporary wards were organized with strict attention to hygiene. Amid the chaos of war, the Americans introduced small but deliberate measures to sustain morale. Red Cross units distributed letters from home. Musical instruments were transported to play soothing melodies, and care packages, sometimes including chocolate, fresh fruit, or small decorations, reached the hospital wards. These gestures were considered as critical as medicine itself. Commanders recognized that morale directly impacted recovery and operational effectiveness. Japanese nurses, accustomed to austere conditions and a culture that prized stoicism over sentiment, were often taken aback by these American practices. In Japan's military hospitals, decorations were rare. Candles were used sparingly, and flowers were largely ceremonial. The emphasis was on discipline, efficiency, and survival, rather than comfort. Encountering a field hospital where American medics thoughtfully arranged floral bouquets beside each cot was a disorienting experience. Candles flickered softly at night, illuminating the faces of the wounded, an unfamiliar warmth, both literal and emotional. The broader context also included the cultural and psychological dimensions of warfare. Japanese medical personnel were trained to endure hardship silently. Expressions of care were restrained, and emotions were controlled even in the face of suffering. For American nurses and medics, humanizing the hospital environment was a tactical and ethical choice, tending to the emotional well-being of soldiers and, later, enemy personnel could reduce trauma, encourage recovery, and reinforce the moral high ground. By early January 1945, American hospital units were actively implementing these practices across liberated or contested areas. Their presence was not solely functional. It was transformative. For Japanese nurses observing from the periphery, the combination of clinical precision, material abundance, and unexpected tenderness created a sense of disbelief. The war's brutality had familiarized them with fear, suffering, and death. Yet here was a different reality, one that challenged assumptions about the enemy and the possible humanity within a field of conflict. These first impressions laid the groundwork for the remarkable interactions that would follow. The stage was set not only for medical interventions, but for moments of quiet astonishment that would resonate long after the war ended. Nurses, accustomed to witnessing death and deprivation, now encountered acts of care that seemed almost incongruous with the violence surrounding them. It was in these intersections of battle and compassion that the story of decorated hospitals, flickering candles, and floral arrangements began to take shape. The scene was ready to unfold. The intersection of culture, strategy, and humanity. A story that would reveal the unexpected dimensions of warfare in the Pacific theater. American medical operations in the Pacific were a feat of planning and adaptability. By January 1945, the U.S. Army and Navy had refined a system capable of delivering care under the most extreme conditions. Mobile surgical hospitals were transported on landing ships, assembled within hours, and connected to supply depots stocked with surgical instruments, medications, and even small comforts. Nurses and medics moved swiftly, establishing wards amid the chaos of ongoing operations, often under enemy fire. Every detail was calculated. Tents elevated for drainage, cots arranged for rapid access, and sanitary protocols strictly enforced. Alongside these practical measures, American medical personnel recognized the power of psychological care. Candles, flowers, and small decorative touches were introduced deliberately, humanizing spaces otherwise dominated by pain, fear, and the stark white of bandages. A single vase on a bedside table, a small bouquet of local blooms, or the soft glow of a candle created a sense of normalcy and dignity. For soldiers, these touches were reassuring. For Japanese nurses observing the hospitals, they were astonishing. These women, trained in efficiency and stoicism, had never seen war medicine treated as a stage for compassion as much as survival. Supply chains made these gestures possible. The U.S. military moved not only weapons and rations, but also comfort items. Red Cross packages included chocolate, cigarettes, and stationery. Local flora was sometimes collected to create improvised bouquets, carried across beaches and jungle paths to hospitals still vulnerable to attack. Medics arranged flowers with care, ensuring that each patient experienced a touch of humanity even amidst suffering. For Japanese nurses, this attention to detail seemed almost foreign, a contrast to their own environment, where flowers were scarce and luxury had little place in a hospital ward. The initial encounters between Japanese nurses and these decorated hospitals were moments of quiet disbelief. In Leyte and Luzon, reports and personal accounts describe nurses pausing in the doorway, eyes wide, fingers brushing against carefully placed petals, the soft light of candles casting shadows over pale faces. There was no fanfare, no announcement. The gesture itself was understated, yet its impact was profound. A hospital, previously a place of suffering and rigor, became a space of reflection, care, and unexpected grace. These interactions also revealed cultural differences. Japanese nurses were accustomed to a system in which hierarchy and discipline dictated behavior. Emotional expressions were restrained, even in moments of grief or relief. The American approach, blending strict medical efficiency with gestures of comfort, challenged these expectations. Nurses watched as wounded soldiers smiled at a small bouquet, or a candlelight glow softened the tension in a tense ward. Some nurses recorded their astonishment in diaries. Others carried the memory quietly, unable to reconcile the familiar reality of war with this unexpected humanity. The effect extended beyond individual nurses. Entire wards adopted a rhythm that emphasized care as both science and compassion. Patients recovered not only because of medical interventions, but because the environment itself fostered resilience. American commanders understood that morale and psychological health were inseparable from physical recovery. These practices, initially small and localized, became standard procedures across many Pacific hospitals. By mid-January, the contrast was clear. Japanese nurses, observers of both battle and care, began to see the duality of American strategy. Victory achieved not only through force, logistics, and firepower, but also through an understanding of human dignity and morale. These encounters laid the foundation for the cinematic moments of astonishment that would define the narrative of decorated hospitals. A single candle, a carefully arranged bouquet, a faint melody from a phonograph, each acted as a counterpoint to the violence beyond the hospital walls. This context sets the stage for deeper exploration, not just the logistical and strategic dimensions, but the human, tactical, technological, and moral angles that intersected in these moments. Understanding the backdrop, the Pacific War, the medical innovations, and the cultural contrasts, is essential before examining the full spectrum of reactions and consequences that followed. Human angle. The most immediate and visceral response to the decorated hospitals was human. Japanese nurses, trained to navigate chaos with efficiency and discipline, were unprepared for the subtle, yet deliberate gestures of care in American wards. For soldiers lying in cots, wounded by shrapnel or tropical disease, flowers and candlelight were more than decoration. They were reminders of normalcy, of home, and of dignity. Nurses observed men reach for a small vase, their fingers brushing petals, eyes softening in the glow of a flickering candle. This human dimension extended to the nurses themselves. Many had endured weeks without respite, treating injuries with limited supplies, witnessing the constant toll of war. The introduction of beauty and warmth into a space defined by suffering provoked astonishment, sometimes even disbelief. Some nurses noted in diaries that they paused, hands hovering over petals, struck by the incongruity of care within a war zone. Others quietly wept, moved by the recognition that the enemy, at least in this context, could exercise compassion. The psychological effect on patients was equally significant. Soldiers reported that the sight of flowers or the soft flicker of candlelight eased anxiety, promoted sleep, and offered a subtle comfort that medicine alone could not provide. These small gestures became critical morale boosters, demonstrating that human kindness could persist even amid conflict. For Japanese nurses, observing these effects challenged their preconceptions of the enemy, creating moments of reflection on the universality of suffering and empathy. Tactical angle. Beyond emotional resonance, the decorated hospitals had a practical, tactical dimension. The U.S. military understood that rapid recovery of injured personnel was essential to sustaining operational effectiveness in the Pacific theater. By attending to morale, medics could accelerate rehabilitation, reduce complications from stress or infection, and maintain troop readiness. The placement of flowers, candles, and small comforts was not arbitrary. Beds were arranged for maximum visibility, with decorative elements serving as focal points to draw attention away from wounds or injuries. Music and gentle lighting created a calm atmosphere, minimizing panic during air raids or artillery barges. By cultivating an environment conducive to recovery, American medics increased the likelihood that soldiers would return to duty sooner, supporting broader operational goals. Japanese nurses, initially skeptical of these soft tactics, began to recognize their effectiveness. The apparent indulgence of decorations was, in fact, a deliberate extension of strategy. Morale, often overlooked in traditional military doctrine, became an active component of battlefield logistics. In observing these methods, nurses gained insight into a different approach to warfare, one where human psychology was as important as ammunition and firepower. Technological angle. The implementation of decorated hospitals relied on logistical and technological innovation. Transporting perishable flowers, delicate candles, and other morale-boosting items across Pacific Islands presented challenges. Engineers and medics devised solutions. Insulated containers for flowers, reinforced boxes to prevent candle breakage, and makeshift refrigeration for chocolate and fruit. Supply chains were extended to include seemingly minor items, recognizing their cumulative effect on patient well-being. Mobile surgical hospitals, known as Mobile Army Surgical Hospitals, MASH units in later conflicts but already evolving during World War II, were outfitted with specialized equipment to support both medical and morale needs. Tents included small tables for floral arrangements, candle holders secured against wind, and designated spaces for music or letters from home. Even under the threat of shelling or air raids, medics maintained these arrangements, highlighting the discipline and planning that made such gestures possible. The Japanese nurses, witnessing this blend of logistical ingenuity and human care, were often struck by the contrast to their own resource-limited environment. In many Japanese field hospitals, maintaining sterile instruments and treating the wounded was an unending struggle. Aesthetic or comfort considerations were secondary, if considered at all. Observing American methods, nurses could not ignore the sophistication required to integrate decoration, morale, and operational efficiency, all while functioning under combat conditions. Transition to next section. These three angles, human, tactical, and technological, reveal a complex interplay between emotion, strategy, and innovation. What might appear at first glance as small gestures were, in fact, deeply integrated into the broader American approach to warfare. Next, the story expands to additional perspectives: leadership, enemy reactions, and moral considerations. These angles illuminate the full impact of decorated hospitals, bridging the emotional and practical consequences observed by Japanese nurses and Allied personnel alike. Leadership angle. The decision to decorate hospitals with flowers and candles was not incidental. It reflected deliberate leadership choices within the U.S. Army and Navy Medical Corps. Senior officers understood that warfare extended beyond bullets and artillery. It encompassed human resilience, morale, and the psychological stability of soldiers. Commanders such as Brigadier General Norman T. Kirk, Surgeon General of the U.S. Army, emphasized holistic care, instructing medical personnel to maintain not only cleanliness and efficiency, but also a degree of emotional nurturing. Field hospital commanders coordinated with supply officers to ensure that decorative items, music, and small comforts were included alongside medical supplies. Leadership mandated that, even under combat conditions, attention to human dignity was non-negotiable. Nurses were trained to arrange wards thoughtfully, to provide bedside comfort, and to treat each patient as more than a casualty statistic. These leadership choices created a cascade effect. Medics followed protocols that elevated morale, soldiers responded with improved recovery, and Japanese observers witnessed a standard of care that was startlingly different from their expectations. For Japanese nurses, leadership decisions became evident in the attention to detail. They noted how American commanders encouraged gestures that, while minor on the surface, carried profound human impact. The careful orchestration of decor, light, and music reflected a vision that saw the battlefield not only in tactical terms, but as a space where human dignity could be preserved. Enemy perspective angle. From the vantage of Japanese medical staff, these decorated hospitals were almost surreal. Accustomed to austere wards and strict hierarchy, the nurses struggled to reconcile the harshness of war with these moments of unexpected beauty. Diaries and post-war testimonies reveal astonishment at what seemed like indulgence. Small bouquets on bedside tables, candles flickering in the dim light, and patients smiling despite injuries that would have normally demanded grim silence. Some Japanese nurses recorded quiet conversations among themselves, whispering about the Americans' care and wondering at the intent. It was a culture shock, an unfamiliar blend of efficiency and empathy. While their primary training emphasized endurance and stoicism, these nurses were forced to confront the reality that their adversaries could act with compassion. The psychological effect was profound. It challenged preconceptions, invited reflection on the nature of care, and introduced a subtle, human dimension to an environment dominated by destruction. Moral angle. The moral implications of decorated hospitals were striking. Even amidst the brutality of war, American medical personnel demonstrated that acts of kindness could coexist with operational necessity. Candles, flowers, and music were not mere ornamentation. They were deliberate interventions designed to preserve humanity in a context defined by suffering. Soldiers who recovered in these wards often spoke of the psychological boost provided by such gestures. Nurses, medics, and commanders all recognized that morale could influence physical recovery, decision-making, and overall resilience on the battlefield. Japanese nurses, observing these actions firsthand, were forced to confront ethical questions. The gestures suggested that care and empathy were not limited by nationality or allegiance. Even in the midst of conflict, Americans treated injured personnel, including, at times, enemy captives, with dignity. This raised uncomfortable questions for Japanese staff, trained to view the enemy through the lens of discipline, duty, and national loyalty. The moral weight of these observations lingered, shaping perceptions long after the war. Integration of angles. Together, these perspectives, leadership, enemy observation, and moral considerations reveal a multifaceted picture. Decorated hospitals were not superficial embellishments. They were the product of deliberate leadership designed to boost morale, maintain operational efficiency, and preserve human dignity. The reactions of Japanese nurses highlighted cultural contrasts, emotional resonance, and the enduring power of ethical care in war. The convergence of these angles set the stage for the defining moment, when decorated hospitals became not only a symbol of compassion, but a decisive factor in the psychological and practical realities of Pacific warfare. The human, tactical, technological, and moral elements all intersected, leading to moments of astonishment that would crystallize in the memories of those who witnessed them. February 1945. On the island of Luzon, the U.S. Sixth Army advanced steadily against entrenched Japanese positions. The battlefield was a cacophony of artillery fire, gunshots, and the ever-present roar of aircraft overhead. Amid the chaos, American medical units established field hospitals near the front lines, often under intermittent bombardment. Here, the full effect of decorated hospitals became apparent. The decisive moment occurred as the first wave of wounded soldiers was brought in from contested zones. Cots were quickly arranged, but unlike earlier hospitals, these wards were adorned with fresh flowers, carefully placed by nurses and medics who had been briefed in advance on morale protocols. Candles flickered in makeshift holders, and soft instrumental music played from portable phonographs. The juxtaposition of beauty and suffering was stark. Soldiers with shrapnel injuries or tropical infections lay amidst color and light, their faces relaxing for the first time in days. Japanese nurses, observing from the periphery, were visibly stunned. Many paused at the entrances, hesitant to step inside, unable to reconcile their experiences of austere wartime medicine with the serene order they now witnessed. Some wrote in diaries that it was like entering a different world. Others silently tracked the expressions of the wounded soldiers, noting the first genuine smiles since the battle began. The moment crystallized a psychological turning point. The Americans had achieved not only medical efficiency, but emotional triumph, subtly reshaping the battlefield in ways the enemy could scarcely quantify. On the tactical side, these decorated hospitals proved critical. Soldiers' recovery times improved measurably. Injuries that might have led to prolonged debilitation were addressed with urgency and precision, aided by the morale boost of a more humane environment. Officers documented that soldiers were calmer, more cooperative during treatment, and less prone to panic during sudden alerts. The integration of aesthetics, light, and music was validated not as luxury, but as strategy, an innovation in wartime medical care that blended the physical and psychological needs of patients. Technology and logistics amplified this impact. Flowers were transported in insulated boxes from nearby safe zones, while candles were distributed in reinforced containers to prevent breakage. Nurses, both American and Japanese observers, noted the precision with which every element was integrated into the wards, despite ongoing artillery fire. Even small details, a vase positioned just so, the soft glow directed to a patient's face, were meticulously planned, demonstrating the Americans' foresight in turning hospitals into spaces of structured calm. The human reactions continued to resonate. Soldiers murmured thanks to medics, sometimes for the flowers, sometimes for the music, sometimes simply for the visible care invested in the environment. Japanese nurses, witnessing these exchanges, began to grasp the broader cultural and strategic dimensions at play. Their astonishment deepened as they saw not just wounded men recovering faster, but morale improving across entire units. The war, in these moments, was not solely defined by firepower or casualties. It was measured in the preservation of dignity and the subtle victories of human compassion. By mid-February, decorated hospitals had become a hallmark of American medical operations in Luzon. Commanders encouraged medics to maintain these standards, even as the battle intensified. Each hospital, each ward, became a controlled zone where soldiers could experience care and normalcy. For Japanese nurses, repeated exposure solidified a pattern. These were not isolated acts, but deliberate, sustained practices that revealed both strategic acumen and ethical foresight. The convergence of tactical efficiency, human empathy, and technological precision culminated in moments that transcended ordinary wartime experience. For the first time, Japanese nurses could witness a war environment where the enemy's humanity was as apparent as its military organization. This was the turning point, a quiet revolution in perception, morale, and medical strategy that underscored the broader significance of decorated hospitals. The next phase would expand on these climactic developments, detailing the outcomes, personal accounts, and the enduring influence of these practices on both soldiers and observing Japanese nurses. The story moved from isolated wards to a theater-wide effect, shaping morale, recovery, and the very understanding of care amid warfare. March 1945. As U.S. forces pressed further north on Luzon, the intensity of combat increased. Mortar fire echoed across paddy fields, and artillery rounds shook the temporary hospitals. Yet within the wards, the atmosphere remained remarkably calm, a stark contrast to the chaos outside. The decorated hospitals had become sanctuaries of order, where the wounded could find respite, and Japanese nurses could witness a strikingly different approach to care. One afternoon, a group of Japanese nurses entered a ward to observe the treatment of newly arrived casualties. They were struck immediately by the meticulous arrangement of cots, each adorned with flowers collected from local fields, candles flickering in small holders, and soft music playing unobtrusively in the background. A wounded American soldier, his leg wrapped in a tourniquet, reached out to straighten a vase of flowers, smiling faintly. The nurses whispered among themselves, astonished at the scene. The combination of precision, comfort, and dignity was unlike anything they had experienced. The direct interaction between Japanese nurses and American medical staff was revealing. Medics explained procedures with patience, demonstrating not only surgical techniques, but also the purpose behind the decorative touches. Japanese nurses observed how flowers were carefully rotated to maintain freshness, how candles were placed safely to prevent accidents, and how even small gestures, a note tucked beside a patient, a quiet word of encouragement, reinforced recovery. For many, This was a profound lesson in the integration of empathy and efficiency. From a psychological perspective, the effects were immediate. Soldiers appeared calmer, more cooperative, and less anxious, even when faced with severe injuries. Japanese nurses noted that recovery often accelerated in wards where morale-boosting measures were consistently applied. Observing these outcomes challenged long-held assumptions about battlefield medicine. Efficiency alone did not ensure recovery. Care for the human spirit was equally crucial. The tactical advantage became evident as campaigns progressed. Hospitals maintained higher patient throughput, and soldiers returned to the front lines faster than anticipated. Commanders documented fewer complications from infections and stress-related conditions. Japanese nurses, accustomed to the relentless attrition of their own system, recognized that these small interventions, flowers, candles, music, and attentive care, directly contributed to operational effectiveness. By April, decorated hospitals were not merely an anomaly, but a sustained practice. Field hospital commanders reported that morale improved not only among patients, but also among medical staff. Japanese nurses, increasingly familiar with these procedures, began to understand their purpose and, in some cases, assisted in maintaining the wards. This cooperation, born from observation and respect, underscored a deeper lesson: that human dignity could be preserved even amid total war, and that cultural differences could be bridged by shared commitment to care. The final decisive moment occurred during a heavy bombardment in a forward hospital near Manila. Explosions rocked nearby supply depots, yet medics and nurses remained calm. The wards were intact, flowers unscathed, candles still glowing. Soldiers were reassured not only by the presence of medical staff, but by the continuity of the hospital's atmosphere. Japanese nurses, standing at the periphery, witnessed firsthand the resilience provided by these decorated spaces. Their astonishment was matched by admiration, an acknowledgement that human ingenuity and empathy could create pockets of stability in the heart of chaos. These experiences marked the turning point of the narrative. Decorated hospitals had moved from isolated gestures to a systemic feature of American medical operations, influencing morale, recovery, and perceptions of the enemy. Japanese nurses, initially skeptical and incredulous, became witnesses to a model of care that combined efficiency, foresight, and ethical consideration. The intersection of human emotion, strategic planning, and cultural observation crystallized in these moments, demonstrating the transformative power of deliberate compassion in wartime. The next chapter would examine the aftermath, how these practices shaped post-battle reports, influenced post-war recollections, and contributed to broader historical understanding of medical care in the Pacific Theater. The impact of decorated hospitals extended beyond individual wards, affecting soldiers, medical staff, and even enemy observers alike. By mid-1945, as the Luzon campaign wound down, the results of American medical practices became increasingly evident. Hospitals that had adopted the combination of rigorous care and morale-boosting decorations reported measurable improvements in patient outcomes. Soldiers recovering from gunshot wounds, shrapnel injuries, tropical infections, and battle fatigue experienced shorter convalescence times compared to units without these enhancements. Even small details, a flower on a bedside table, the soft flicker of candlelight, or a faint musical melody, contributed to a measurable reduction in stress and anxiety. Post-battle reports from the U.S. Army Medical Corps documented these effects with precision. Officers noted that soldiers treated in decorated wards exhibited greater compliance with rehabilitation protocols, fewer complications from infections, and improved psychological stability. Recovery rates were higher, particularly among those with severe injuries, and patients expressed gratitude not only for medical attention, but for the humane environment in which they were treated. The reports emphasized that these results were not accidental. The integration of aesthetic and emotional considerations into field hospitals had been deliberate, supported by leadership and logistics alike. Japanese nurses, many of whom had continued to observe or assist in the wards, recorded their astonishment. Diaries and post-war interviews highlight the disbelief these women experienced when witnessing the care extended to both American and Japanese patients. For nurses accustomed to austere hospitals, limited supplies, and strict hierarchies, the sight of carefully arranged flowers and flickering candles in the middle of a combat zone was both surreal and instructive. Some noted the profound impact on morale, recognizing that even small gestures could alter a patient's outlook, strengthen cooperation, and accelerate physical recovery. The effects extended beyond the wards. Soldiers who recovered in decorated hospitals returned to combat duty faster, often reporting improved mental resilience. Unit cohesion improved, as men found reassurance not only in the efficiency of their medical care, but in the humanity embedded in their environment. Commanders recognized that such practices reduced desertions, minimized stress-induced errors, and reinforced the psychological readiness of troops. The decorated hospital became more than a space for healing. It became a strategic asset, subtly influencing the broader campaign's effectiveness. Red Cross and auxiliary organizations noted the ripple effects as well. Letters from patients to family members often described the serene hospital environment, the unexpected attention to detail, and the quiet care provided by medics. These accounts circulated among troops and support staff, reinforcing the psychological benefits of decorated hospitals. Even Japanese civilians and nurses documented these moments, acknowledging that the combination of care, aesthetics, and attentiveness had a broader moral and cultural impact, offering lessons in empathy that transcended wartime enmity. These outcomes underscored a fundamental lesson. Medical care in war extends beyond treating injuries. Psychological support, environmental comfort, and small acts of human kindness can materially affect survival, morale, and operational readiness. In this context, the decorated hospital was not a minor innovation, but a deliberate intervention with measurable consequences, a synthesis of strategy, logistics, and compassion. The stage was now set for a comprehensive view of the longer-term consequences. The immediate post-battle reports, soldiers' testimonies, and Japanese nurses' observations all pointed to a transformative understanding of care in wartime, one that would shape medical practices and perceptions of humanity under fire. In the months following the Luzon campaign, post-war reports and personal accounts began to capture the lasting impact of decorated hospitals. U.S. Army Medical Corps documentation emphasized that morale, psychological well-being, and environmental considerations had contributed significantly to recovery rates. Officers highlighted that soldiers treated in these wards returned to duty faster, with fewer complications and improved mental resilience. These observations were corroborated by Red Cross records, which detailed not only medical outcomes, but the sustained emotional support provided to troops through flowers, candlelight, and thoughtful ward arrangements. Japanese nurses, some of whom had remained at the hospitals during the American advance or had returned post-war to assist in humanitarian efforts, offered reflections that highlighted the cultural and human dimensions of these practices. Diaries, letters, and oral histories reveal astonishment and admiration. Many nurses noted that the Americans' attention to detail, arranging flowers carefully, placing candles at safe intervals, and creating soothing spaces, challenged their understanding of wartime care. The unexpected humanity they witnessed left a profound impression, illustrating that even in the midst of relentless conflict, acts of compassion could endure. These reflections extended beyond individual impressions. Japanese nurses recounted sharing their observations with colleagues, sparking discussions about the role of morale, dignity, and empathy in medical practice. For many, the experience served as a lesson in integrating care with operational efficiency, demonstrating that humane treatment was not incompatible with the demands of war. It also provided a rare glimpse into American culture and leadership priorities, emphasizing both strategic foresight and ethical considerations. Historical analyses conducted after the war confirmed the significance of these practices. Scholars of military medicine noted that decorated hospitals exemplified an innovative approach, blending psychological care, cultural sensitivity, and logistical precision. Morale, they concluded, was a tangible factor in recovery and operational effectiveness, a factor often overlooked in traditional accounts of combat strategy. Field hospitals that prioritized dignity, comfort, and emotional support demonstrated measurable benefits, influencing later practices in subsequent conflicts and shaping modern military medical protocols. Moreover, the decorated hospitals offered a broader lesson about human behavior under extreme conditions. They demonstrated that compassion could coexist with violence, that small gestures could reverberate across a battlefield, and that cultural differences could be bridged through deliberate acts of care. Japanese nurses, observers of both destruction and kindness, became witnesses to a new paradigm, one where ethical responsibility and operational necessity converged. Their astonishment and documentation of these moments provide historians with rare insight into the intersection of culture, medicine, and psychology in wartime. By the end of the Luzon campaign, decorated hospitals had left a lasting mark. Soldiers recovered faster, morale improved, and the lessons learned resonated beyond the Pacific theater. Japanese nurses carried these memories for decades, often reflecting on the incongruity and inspiration of what they had witnessed. The small bouquets, flickering candles, and soft melodies became symbols not only of care, but of resilience, demonstrating that even in the most destructive circumstances, humanity could endure. These outcomes prepared the narrative for final reflection. The immediate and long-term effects of decorated hospitals extended far beyond recovery statistics or battlefield efficiency. They influenced cultural perceptions, post-war medical practice, and an enduring understanding of what it meant to preserve dignity in the midst of war. War is often measured in numbers, casualties, territory gained, battles won. Yet in the midst of destruction, the human spirit asserts itself in subtle, profound ways. The decorated hospitals of the Pacific Theater stand as one such testament. Flowers on bedside tables, candles flickering in dim wards, soft music drifting through tents. These were not trivial details. They were deliberate acts of care, designed to preserve dignity, bolster morale, and remind soldiers that even in war, humanity endures. For Japanese nurses witnessing these practices, astonishment gave way to reflection. In the austere, regimented environments of their own hospitals, such gestures were almost unimaginable. Yet the Americans demonstrated that empathy could coexist with discipline, that operational efficiency need not exclude compassion. Observing this interplay challenged preconceptions, offering a rare glimpse into a different approach to warfare, one where ethical consideration and strategic planning intertwined. The legacy of these decorated hospitals extends beyond the Pacific Islands or a single campaign. They reshaped the understanding of battlefield medicine, highlighting the critical role of psychological and emotional support in recovery. They influenced the culture of military medical care for generations, teaching that morale and dignity are as vital as surgery and medication. Moreover, they offer a broader lesson about humanity, that even amidst destruction, deliberate acts of kindness can leave lasting impressions, reshape perceptions, and bridge cultural divides. Ultimately, the story of decorated hospitals reminds us that war is not defined solely by the weapons we wield or the battles we fight, but by how we care for one another in the spaces between. Candles, flowers, and soft melodies became symbols of resilience, courage, and the enduring power of human empathy. The nurses who observed, the soldiers who recovered, and the medics who labored quietly all contributed to a narrative that transcends combat, a narrative that speaks to the possibility of compassion even in the darkest hours of history. In these moments, history teaches more than strategy. It teaches the profound capacity for humanity to persist, to astonish, and to heal, even when surrounded by the unrelenting chaos of war.